The Shared Family Care program is unique. It allows the parent and the child to live together while they are receiving services.
Unlike foster care, Shared Family Care provides the total care, support, and training for not only the child, but also the child's parent.
This particular program puts the whole family in foster care, you know, because you have to rebuild the whole family. You have to start with the parents.
Shared family care works, and it really does fit into that context of the overall redesign of child welfare services. It's community-based, it's strengths-focused, it's relationship-based with the folks involved, and it's highly individualized. It's not a one-size-fits-all. The key to child welfare is finding an array of services and support so that you can match the services and support to the needs of the family that you're working with. And you've got limited dollars, you've got limited money that you're going to be able to put into these services, so you've got to choose ones that work. And shared family care is a real good example of doing that.
Three of the most important goals of the state redesign effort are community partnerships involving the community at different levels, engagement of families in the development of their own case plan, and using less adversarial methods of working with families. And shared family care encompasses each of these principles. These are parts of the foundation of what shared family care is built on. The use of the individualized family plan helps families be involved right from the start in working out the plan for their reunification with their children, and involving mentors. This is really the big thing. Involving the mentors involves the community at a level that they've really never been involved at before. It's very much like the resource families in Family to Family. It takes it a step further even, because the natural parents of the children are actually living in the mentor family's home. This is involving families in the work of child welfare in ways that professional social workers just can't.
I met a wonderful mentor who, even after I moved out of her house, I was still extremely involved with her and her family. She helped me with parenting issues, she helped me with budgeting as far as going out and shopping, she helped me spiritually. She noticed the signs of when I got stressed out with dealing with my children and when I needed to just step back. The adage of it takes community to raise a child really comes to life in this program.
You can come at shared family care from two directions. One is you can have a child welfare director who says, I've looked at this and this looks good to me. This looks like something we want to implement with our counties. Private providers, could you help us out with that? Conversely, you can have private providers saying, boy, we've got the capacity to do this, and we think it looks like it's got good data and it's evidence-based, and they can come to the child welfare director and say, we think there's something here that could really benefit the kids and families of this county. We'd like your support with this. But the bottom line is, ultimately, those two have to come together in a partnership to be able to make this work.
We've been involved in shared family care for over 6 years, and one of the real benefits for shared family care for the agency and the staff has been the development of close working relationships with community-based organizations that have been providing the services. In
Contra Costa County, you've got a county that's not afraid to experiment and try new things. You've got a provider in FamiliesFirst that can do that and has the infrastructure to deal with it. And you've got a program that works. You've got mentors with the kind of emotional and personal capacity to be able to share with those young women and their children.
Contra Costa County has been supportive of programs like the Shared Family Care program because we realize the importance, first, of keeping families together and providing capacity for families.
The Shared Family Care is a very important part of the overall child welfare program. It offers us an opportunity to provide not only an alternative to the traditional foster care system, but also to work with a child, their family, in a very supportive and inclusive environment.
Shared Family Care is a program that stretches a county's commitment to doing social work. Because Shared Family Care is about rebuilding a whole family, it requires the partnership of agencies that provide a variety of services. Most importantly, job training, substance abuse treatment, housing, and education.
The benefits of the program are numerous. The most important thing is that it does help reunite families. It helps the families to stabilize. and to become self-sufficient and self-directed.
Families who have graduated from shared family care, many of them have also graduated completely from the welfare system itself.
The recidivism for children that have been in shared family care is half what it is in terms of children in regular foster care. That is a definite benefit for all of us, especially as we're looking at federal outcomes.
We have a 70% success rate. Success in this case means that the families are employed, they're in permanent housing, the children have stayed with the moms and dads. No longer are they accessing the level of resources that they once did, so the cost to support those families from the public's point of view is far lower. It works.
In this difficult budget time, we've got to make some difficult funding choices. And we do prioritize our programs so that we fund prevention programs like the Shared Family Care Program, because we find that if we don't invest money up front now, we're going to pay more downstream down the road.
I would strongly encourage other nonprofit agencies like Families First to develop a program like Shared Family Care. Why? It works.
To think that instead of removing a child, you were able to give the mom and the child or children a really safe, nurturing environment. It's professionally, it's a wonderful feeling.
The child welfare system in California needs to be improved. However, many of the solutions are already out there. The California counties have developed many promising practices that are now proven practices, much like shared family care. Let's spend our time bringing these programs to scale.